You're never too young or too old to talk about self-care, which is exactly what we do here on What's Going On Mental Health Mondays. And joining me to talk some self-care, I have Dr. Danielle Long with Harbor, a behavioral health care provider. Dr. DeLong, how you doing?
I'm doing well. I'm happy to be here.
Happy to have you. And when we're talking about self-care, a lot of that comes with sometimes is mental health stress, specifically issues like depression. Now we know that adults can get depressed and experience depression, but this can also happen to kids as well.
Absolutely. And I think that children, it can sometimes look a little bit different. I think we equate depression to sadness. And as adults, I think we do a pretty good job at identifying sadness for most of us. Children, sadness is a little bit different. The way they express depression, as we call it, could be in being irritable, just getting agitated, having a short fuse, not concentrating, maybe a change in sleep or eating habits. And because they're young and they're learning from us, sometimes they need us to help them figure out that that's really what's happening inside.
Okay, so I know we have a lot of caregivers, a lot of providers that watch this show. I know that they are monitoring sort of their children's behavior. When would be a time to call in a specialist or to call you all?
That is something I think everybody should be aware of. I think very often we think it's a phase, or oh, we'll just wait, even for ourselves. Oh, it's just something I'm going through right now. I think once you start having those thoughts that something isn't quite right, that's always the best time. I think sometimes we wait too long, or we wait until it looks like the neighbor next door. Well, when they were depressed or when their kiddo was depressed, it looked like this. I've got to wait for it to look like that. I always think, as a parent myself, the best time to call for help or to just inquire about help is the second I feel like maybe something's not quite how it used to be or how I think it should be.
Okay. Oh, wow. And there's a lot of other services that Harbor provides as well. Can you talk a little bit more about that?
Yeah, Harbor provides a lot of mental health services. So those services for depression or anxiety, when we're worried, when we're scared, when we're anxious. We also provide substance use treatment services for individuals who may struggle with different types of addiction. We offer services for individuals with autism from as young as 12 months of age, providing applied behavior analysis treatment. We also provide group services. Sometimes individuals might not feel like individual talk therapy is a fit for them, whereas a group service would be really great for them to really process what's going on.
I like that, a lot of different options. And how can people find the Harbor?
Harbor can be found on our website at harbor.org. We have a number of locations in the Northwest Ohio area, and Harbor has a main number that individuals can call to schedule or to reach out for help.
Thank you so much, Dr. DeLong. Thank you for tuning in for another Mental Health Monday. Until next time, we'll see you.